My name is Iboya, and I'm a PhD candidate at Trinity Western University. And Dr. Cheryl Reimer-Kirkham and Dr. Kendra Rieger are my co-supervisors, the two members of my dissertation committee, and they are helping me with my dissertation and my studies. They contributed, but they couldn't be here today. In true social sciences fashion, I'm going to address my social location. I'm presenting today as a white Christian woman who works in a public healthcare organization in a senior leadership position. I grew up in Romania, and when I grew up there, it was still a communist country. And in those days, religion or any religious affiliations that were not sanctioned by the government or following the government were prohibited or were suppressed. So what I've learned there is that talking about religion and spirituality is very important, and especially as we are moving more and more, and what we see across the border with diversity, equity, inclusion being silenced, it kind of raises some concerns for me. And when I moved to Canada, I thought we are in this space where everyone's open, and what I'm finding, it's quite a lot of inhibition. So coming from where I grew up was quite a surprise, which made me curious. I also want to bring forward a story about my colleagues. There are many stories. Each of you may be able to relate to someone, but I'm thinking about this particular colleague. I'm going to name her Sarah. And she was raised in Canada. She has discovered recently her Islamic roots, and she wanted to bring her faith at work. And she asked for access to a prayer room, and she wanted to practice her faith. And we know what to do. We're a bit better. We're not there yet with patients, but we don't know what to do with staff. And that, even though I worked for the same organization for 22 years, I would say a considerable amount of time, I am in a regional senior executive position. I didn't know what to do. So I wasn't aware of any policies or any supports. They were not visible to me, and we didn't know what's permissible and what we can do to support her request. So I will ask you to follow me in this story, and I'm going to weave it through with some of my literature review and my learnings and kind of how we follow through with Sarah. Religion and spirituality in healthcare share a long, arduous history. Started in 1637. Come in, just step in. By Augustinian nuns. They established the first Catholic hospitals in Canada. And the history of nuns, whenever I read it, I'm not from Canada, but it's a complex duality because they provided essential services, essential care for individuals who were afflicted by some serious medical conditions. They were communicable diseases like tuberculosis or Spanish influenza. They cared for wounded soldiers, so you'd think of the nuns as exceptional. And then on the other hand, they participated in residential schools in this system that contributed to systemic oppression and genocide of indigenous peoples. So with this in mind, religion can bring healing, and it can also bring deep hurts, and which is why in public spaces it's important that we address it carefully. The social-political influences in the context of secularism, and I define secularism strictly as a division between state and church, with new widely accepted beliefs that sometimes contradict our traditions, and religious teachings create tensions for people. And we can't return to the authority of one religion, so this is a dilemma, and say, this is what dominates, we are all going to have the same processes and beliefs based on this religion, nor can we be in a totally secular space. So the path is between these two extremes, and finding that balance, because we talked about the balance, is a challenge, and my scholarly interest. I don't know if I'm going to find the answer, but that's what I'm curious about. Particularly in healthcare, where I work and my career, we are called, like many organizations, to respond right now to diversity. We want to foster healthy workplaces. We champion equity, diversity, inclusion, but we don't talk about religion. Religion is not part of the DEI in all our documents. And I probably am not going to spend time unless you really want to, like what are the foundations in Canada that help us or give us that standing, that legal standing under the Canadian Charter for Human Rights and Freedoms, in BC, the BC Human Rights Code. They help us ground ourselves, saying that we need to respect other people's beliefs and freedoms. In addition, of course, we are in the backdrop of Truth and Reconciliation, and action number 48 calls out specific actions that health organizations need to do to acknowledge respectfully the historical wrongs and support the expression of indigenous spiritualities. Therefore, we can't create this public space that's empty of symbols and religious practices without creating some alienation for a group or some conflict for the other. And I think that's what stifles us, that's what stops us, because it's such a complex space and it's hard to enter in without disrupting. We talk about disruption. However, we have no choice, because if we want to be respectful, I think we need to enter in that complicated space. I want to also acknowledge some good work, and I know we have a colleague here, Simon, from the Canadian Association of Spiritual Care Practitioners. When I've done my literature review, I really appreciated how the CASC has taken up the language and symbols, and it's inclusive. And if you read anything about religion and spirituality, it's all about, we don't have consensus on definitions, we are still discussing what's religion, what's spirituality. But CASC has truly adopted a broad view of spirituality, and they are supporting this sense of beliefs beyond religion, which is not common with everyone who works in the healthcare space. And last but not least, in healthcare, like in other public spaces, we talk about duty to accommodate policies, which is what I want to talk about and what I'm challenging. Because when we talk about duty to accommodate, we are talking HR, an administrative policy language. It does not refer to an individual's uniqueness, dignity, respect, which are all those aspects and values that we talk about as organizations, specifically healthcare organizations, DEI. So there is a conflict, again, between how we approach people's needs, like Sarah. Under the duty to accommodate legislation, I could go and allow her to attend religious observances or wear certain clothing. However, if she lived in Quebec, she couldn't do it because of Bill 21. So I started to think of what do we do to foster respect. So for the scholars in the room, this is from Dr. Kendra Rieger and Dr. Cheryl Reimer-Kirkham. They asked me to include my prisma. So here it is. I've asked what is known about workplace spirituality and religion and DEI, and that's applicable in a healthcare context. I've done a lot of reading, not to be proud, but just to kind of show you the depth of what's out in the literature. Over 10,000 records, and very interestingly, as we talk about workplace spirituality, literature in the law or in business, they talk about workplace religion. The literature in healthcare, that's very minimal, talks about spirituality, because we want to stay away, even in nursing, around that duality between religion and spirituality. We try to be inclusive, but we don't really know what we are expressing, because sometimes we can dilute this concept. So in the literature, what we found is that when we are looking at implementing legislation against discrimination, even though it is meant to protect and to challenge the rights, actually it's not happening. So the legislation, even though it exists, it is not, the experience of the individual in the system is not very supportive. And what lots of authors, and I can give you references, they say there is lack of equitable access to employment and promotions for people who don't look like us, whoever us is in power. There is a lack of differentiation when we think about who the other person is, because we kind of conflate ethnic, religious, cultural group needs. They are all different. Also, in the European Union documents that I looked at, even though there are directives to ensure equal treatment, regardless of racial, ethnic origin, and anti-discriminatory laws, they are very fragmented between the countries. And the immigrants and minority groups don't have access to healthcare the same way, and they have poorer health outcomes. Also, in North America, in the US, which tends to be more religiously open, it is open to a certain religion that's a dominant religion. So physicians, nurses from minority groups exit the profession much sooner. And when they ask for accommodation, the differences in their social identities are coming up because all the burden is placed on that individual. You need to ask for time off during Ramadan. You need to ask for time off for your day-to-day practices. You are different. You need to ask for an accommodation because you want to wear a different attire. And often, those people who come and bring those religious accommodations, they are also coming from religiously or culturally or ethnically or socially disadvantaged groups. So see the lens of intersectionality. So thinking about specifically about duty to accommodate, I worked in policy, so that's why I'm very keen to dissect it. A core challenge is really identifying what are those equitable rights, when we talk about what's equitable, and what are those reasonable religious accommodations that an employer can adhere to once we all agree to a standard of employment or standards of care, and we work in a pluralistic society where we have a multiple religious and non-religious workforce. So the tapestry of Canada is changing. We no longer have one dominant face, even though it's predominant, it's not dominant. We have about 6.1% Indigenous, people who identify with Indigenous customs and lifestyles. We have the non-religious, we have the spiritually not religious, we have the non-religious. This new diversity, as Laurie Beeman, who is a scholar of religion and law, calls it. So what do we do as senior leaders in an organization? Whose voice do I hear? That's a challenge that I'm experiencing. So on the one hand, you think that it's quite complicated to develop organizational principles that includes both religious citizens and those who are entirely secular, because you have some people who fight for freedom from religion and others fight for freedom for religion. So what do you do? A rigid approach that involves the organization mandating that we exclude spirituality and religion could be a preferred option, but it presents challenges to minority groups and those who want to have their beliefs supported. On the other hand, if we think of the truth and reconciliation, we are really not responding to our call to action. Alternatively, if we fully embrace the religious and return to those religiously led organizations, the question will be now, whose religion are we going to follow? What practices are we going to represent? And then, of course, the question is, who's not represented and what do we do about them? Even in terms of language, when we think of the language of how the duty to accommodate is set up, we know it sets us in a binary position between someone and the other. And when we talk about the other, that's a minority group that has divergent group from the norm. In Sarah's case, she was the other from the rest of us because she had different needs than my needs. And if we think about the accommodation of religion beliefs in a secular workplace, we also, as Laurie Beeman says, it carries this paternalistic connotation of governance, where an employee has to make a request that is additional away from the norm, and we assume that the norm is the secular state. And when we take this, we silence the minority, or the minority is absorbed in the majority, and that leads to double discrimination. So we can say nobody asks, and we should ask ourselves, why don't people ask for accommodations? It's because all the burdens placed on an individual. So if we think of the multiculturalist paradigm that Canada promotes, if we think that we are a pluralistic, diverse society that's respectful of minorities, then really we are contravening the duty to accommodate by not having a different view, because right now we tolerate requests, but that's not inclusion. Tolerance is not inclusion. So, cultivating the workplace, this is my last slide. I thought about the title, and for those who are farmers, cultivating comes from farming, and it indicates hard work, toil, and labor. And we have to prepare the ground, seed, pull the weeds, expect the harvest. I'm doing that. I'm not a farmer. I have a small garden, but it's a lot of work to get a cucumber. And using this analogy seems to me kind of meaningful, because it tells me how much hard work it's ahead of me for this to happen. Also, the farmers have patience because they don't see the work. So some of you may have heard of an author by the name of Douglas Hicks. He writes in the workplace spirituality literature. He coined the phrase respectful pluralism. He invites us to come to start policies that actively, I jumped ahead, that actively reflect the different spiritualities and religion and talk about those. And to me, to see that activated, it would mean that we are moving away from HR and legal. Like, how many people like to meet with HR and with lawyers if they have a question? I don't. So instead, for people who are professionals, who have a deontological code, who have a code of ethics, who have a professional practice standards through their colleges, we can move to something that's more based in professional practice. And ultimately, we should move to what are the ethical goals of healthcare organizations, because we are there for the well-being of the entire communities. So to me, we can start by creating safe places where we can discuss the difficult dialogues. We can invite people into that, and I really appreciated what Dr. Lisa Miller shared. And being open to other people's beliefs doesn't mean that we adopt them. So kind of creating the safe place where we ask people to come, but come in that respectful way, and don't come with fear. Because I think that's what happens in the system, and it's a fear, what if I'm going to miss out? What if nobody hears me? What if my voice isn't heard? And especially when you come from people whose voice have been silenced, they tend to amplify it or really silence it. So the system, in my view, needs to be more in step with an organizational willingness to support the diversity of belief. I would also hope for formal approaches in which we allow employees to select their own holidays, have some 5 days that are, Singapore does that, India, other countries, where there are 5 common days everyone takes, and then 5 days are your alternative. So you can select, I want a time off during Ramadan or a special occasion, versus everyone gets Easter and Christmas. That may not be meaningful. And it just leads into more secularizing of those moments that are important for my faith. The organizational approaches would shift the orientation from the individual having to make a request to an organization welcoming the diverse views. So to think of Sarah, when she would have been hired, I could have welcomed her and tell her, you have flexible scheduling. And not only that, but I will give you information. Where are all these places you can go and pray? And you can wear the clothing, and here is our policy for attire. As long as you are safe, it's okay what you wear, as long as it's not offensive. But you can have a head cover, you can show up to work, you can express it, and we welcome it. So that would mean shifting from this risk and legal language instead of values, human dignity, and recognizing that people deserve equal respect. So that's why I think my dissertation fills a gap. There isn't much written, so I am continuing with my study in 2 health organizations. Maybe, who knows, in 2 years I'll be here presenting my findings. But as I said, welcome questions and curiosities.
Yeah, so, I mean, this is my 7th year here in Canada. And we haven't celebrated like Lunar New Year and Chinese New Year I can celebrate at home.
Yes.
But I don't have any time being asked like, do you need a break? And
Yeah.
is there anything we can do for you accommodate to celebrate your festival in your culture? And there was one thing I was touched on this year, and it's the Chinese New Year or Lunar New Year or whatever, and always like according to the lunar calendar, always between like the end of the January and the first week of the February. Only one time this year, my daughter in school and middle school was asked by her teacher, do you need a day they can give you off and for celebrating your own festival? I was so touched. I mean, things is getting better and better.
Yeah. I didn't have time to go into the benefits, and I think that's what was so surprising for me. You would expect that healthcare would recognize this because we care for people, and we should be leading in this space. I would say teachers, educators, healthcare, social work. And it's a business world that's leading. They are recognizing, the big businesses, like American Airlines, Apple, Google. They are bringing in chaplains. And they are seeing the benefit to their bottom line. Why? Because people whose values are being recognized, they stay.
I was just wondering the extent to which you've explored the epistemic conditions that make these kinds of discriminatory practices possible. And the reason I ask is because, there's been a lot of critique in the philosophical literature around how, particularly in medical establishments, discriminatory practices become the norm because there's a strong drive toward normativity
and efficacy, efficiency,
efficacy, and all that sort of thing.
Yeah.
And to my mind, that's connected to how secular science and secular practice have been embedded within that system.
100%.
But that's only one version of secularity. And it seems to me that alternate versions of secularity, where the secular is a neutral space where people can be on an equal playing field to practice in their own way and to be free to practice in their own way is perhaps a more liberating alternative.
Yes.
And
we need that.
And I'm wondering the extent to which you are accounting for that in your work.
Yes. Yeah, so the separation from church and state is absolutely necessary, especially in a pluralistic society. Again, because there is a dominance of one over anyone else. So without secularism, okay, well, all right. That was, you see? This is how it signals. This is a signal. So without that basis, and I think that's the basis of the legislation, freedom for all, freedom of belief, freedom of expression of beliefs, it's based in secularity. So in that sense, it's important. In that version. But
what I'm saying is that
there is the other one, and that's where I'm going. And that's where I'm going. And then with the evidence-based medicine, with the evidence-informed practice that has separated science, how we know it in empiricist science, which is what we adore, what we worship, we have moved away from the other aspects of care. And the spiritual aspect of care is no longer part of the formation of many nurses, many physicians, many healthcare practitioners, because that's being kind of pushed to the margins outside of the public. We are here to heal your body. Our focus is on a huge emphasis on the body, some mental, limited, but the spiritual is not part of our work. And my master's thesis was on nurses' competence, self-perceived competence in addressing spiritual needs of patients with life-limiting conditions. And basically they are saying, I'm not competent, and I'm not perceiving myself as competent because I haven't been taught. But people who are being taught, they see the value. So I think there are so many factors. One, the system doesn't encourage it. Second, we don't teach it consistently. Third, we don't think it's part of our work. And then you, all of a sudden, over time, you find yourself in a workforce that doesn't have awareness, knowledge, but the patients are asking for it, and then we don't know what to do. And I think that's where we still have, like having spiritual care practitioners who are educated, who are professional. I think it's a wonderful, wonderful pathway, but we still need to have some entry competencies for everyone, those general, so they contribute.
My hunch is that the way in which medical professionals are trained informs their own understanding of normativity.
And the world, and the worldview.
Causes them to implement certain policies that wind up
100%, 100%. We talk about these things, but depends on who's there. Like, as I said, I've been in the medical, nursing, healthcare field. Nobody talked about spirituality. I went to, when my CEO asked me, so what are you doing, Iboya? And I said, I'm doing my PhD. Oh, great. What is it on? Workplace spirituality. His face dropped. You know, it wasn't, if I would have said, I'm doing it on diabetes, I'm sure his face would have lightened, because it's not the same value to the organization. Please don't tell my CEO I said that. That's a private story. Yes, and I pushed and I said it very nicely. It's about the organizational culture. And if it's good for one, it's good for all. Thank you.
Wonderful.
Thank you. Thank you. Sorry, did I keep you longer? Oh.
No, I take some time.
Well, thank you for being interested, allowing me to percolate.
What's the topic of dissertation?
Looking at workplace spirituality. So I'm doing a critical ethnography study. I will be connecting with spiritual care providers, nurses, physicians, indigenous liaisons, HR administrators, and really looking at two organizations. One's a religiously led, focused, like a value-based organization, and the other one's the organization I work for, a public health organization, and seeing if there are any similarities, any lessons we can learn from one another, and then hopefully influence policy. I've been involved in policy with the ministry in nursing policy secretariat and allied health, and there isn't much guidance, so I want to bring the information back to them and see where we will be.
Imagine we lost power in here too, right?
You did, but I didn't need it.
We lost power, but not steam.
Thank you.
Yeah, apparently it was campus-wide. Things appear to have turned back on.
We were in the discussion.
I would encourage you to maybe take the stairs. I don't know what the protocol here is, but if you're leaving,
I don't know.
It was off, but it's now back on. Never mind.
Thank you.
I'm going to go check the elevator.
Thank you. Yeah, I think for some people it's really important. Like for me, this is very important to me.
Yeah, especially for like the people from very strong religious tradition and atmosphere and family, and they have this need being when like we offer accommodation, like to as my example students to feel like more respected and equally and treated and more grateful. It's like in the long run, it's for helping them. Become more confident. Connected.
It's like this conference. Like there are people who have very divergent views about spirituality from mine, but I welcome it. And it's a safe place where we can have some stimulating debates without feeling threatened.
So one of the things that I'm very aware of is that healthcare, in my experience, seems to be a very strong
hierarchical.
Not only hierarchical, but it's very strongly socially bounded. In
Huge.
the sense that the entry requirements to become a healthcare professional are very, very high.
I see what you mean.
And unless you meet that threshold, which is predicated on excluding the religious,
yes,
it can be very hard for healthcare professionals to accommodate anything that doesn't conform to the norms, of those organizations.
Yeah.
And so what you're talking about is, to my mind, requiring such a deep cultural shift in healthcare at almost all levels of organizational life, but at all levels of professional life, that we're talking about a decades, if not centuries long process.
Yeah, and not being naive, I don't know if anyone can do it, but we can start talking about it.
Yeah.
And in at least the BC College of Nurses and Midwives that I belong to, we have language around respecting different religions and spiritualities. International Council of Nurses that represents the, I don't know how many, 90 million nurses across the globe, they have language. So we actually have documents. There is a Canadian Nurses Association has a position statement around spirituality and religion for nursing. So, and nursing being a predominant profession, we have some solid policy documents that we can go back to and say, are you aware of it?
Yeah.
I don't need to create it.
I guess my question is, to what extent do policy documents actually translate into cultural dynamics?
And that is part of my document review that I'm doing for my dissertation, because that's what I'm asking. Like, we have these documents.
Yeah.
Have you heard of them?
Yeah.
Probably not. Nobody shared them with you. Probably not. And then questioning, why do we have this disjuncture? And because the system will not tell you, it's not in your orientation, it's nowhere, because we don't acknowledge it.
Yeah. Fantastic work.
Yeah. Yeah. Well, thank you very much.